long time. Everybody knows about the hip, knows about the knee, the back, but very few actually take time and understand the ankle. So I'm gonna use some time for you to feel things today that nobody has shown you before. All right, so when I have feet here, first thing is I look at the feet, are they parallel or is one lying this way, okay? And if this is lying this way, please stop working on the foot and go a bit more proximal. See, look at the hip, look at the SI, look at the knee. All right, so that's the first thing you should look at. Second thing is, I always use both hands. I never use one hand. Always compare. When we're talking about hands, about feet, compare, because there's no black and white here. It's always comparison. Is this more swollen than the other? Is this moving better than the other? Because I'm bad at numbers. I can't tell you 80 degrees, 50 degrees, I don't care. Is it comparable or not? So first thing I do is understand where do I have access to the joint itself. Why do I need to know this? To know if there's any fluid. So I always understand that there's access here and here. That's where we kind of inject whatever. And if I just touch it here very smoothly, I find there's no difference. So it's quite, can you guys see? Mm-hmm. So there's no effusion, there's nothing going on here. And then I just see how much can I, so once you see those pop up, it means she's helping, right? So I would just let her relax, yeah, and they vanish. Once they vanish, I kind of check which is going further. I just don't use my hands, I'm kind of lazy, so I just use my weight. I want to make sure which is going further. So I think this is better than this. Slightly, not that much. Same thing goes here. All right, she has no pain, I guess, now with these, but you won't be strong enough to check, right? So just go here and check which is more into dorsiflexion and which is not. Then what's important is the ATLF ligament spans from the fibula, which is here, down this way. So I hold the feet and I try to press here, and I go into eversion and see where can I go deeper. The foot that takes me deeper inside is the foot which lacks this bridge, because there's a bridge here, and this prevents me to go deep into the joint. So I want to go into that joint here. If there's a bridge, I can't really press much inside. So I just compare both feet.
So there should be a bridge. Like
There should
no
be
bridge.
some resistance here, right? So
So the foot that allows you in deeper is the more dysfunctional foot.
there must have been trauma. So I think this is it painful here? This one more than this.
Yeah.
Yeah. It's here is more painful.
yeah.
So there must have had
Right
a
there.
sprain here. Just to compare, this feels good. This feels kind of empty. And if this feels empty, I go a bit above and below to see if there's any scar tissue, which is here. That's small scar tissue. Here.
Yeah, that's
Very
tender, yeah.
That's a small scar tissue. So she must have. Everybody had a sprain at one point, but it's nice to have a feel, and to ask the patient, and the patient realize that you are asking the right questions. They would have a connection. He knows what he's doing. This is how you build trust with patients. It's way much more than giving them information they don't know. She knows that she had a sprain, maybe, but once she knows that you found out without asking her, that's the aha moment. Okay, I'm with the right person here. So I do feel a scar tissue here. So for now, I want you guys to try to appreciate this in turns, because try to feel it now. Just take turns and appreciate the difference.
Yeah. very quick learner.
In a bit. Yeah,
I remember the deepness in it, or the...
just as a little like module or
There,
something,
yeah,
yeah.
yeah, where is it? So that's that lump there.
Yeah, below it, small lump. And above it, it's gonna empty. And you can see it mostly when you go into low reflection. Don't press too much, it's gonna hurt you. You go up and you
So you will be conscious of people.
Everybody felt it so far?
Video you essays for folks.
And then you have to work on your dynamic stabilizers.
It's all right already. You know exactly where to go.
No, numbing it. Go back to play. So these two metatarsals are the ones that are connected to our navicular bone. So this is how we find our navicular bone. You can always look at the skeleton or my diagram. So these guys, they will end in a navicular bone, which is the first spot you hit here. If you go up, that's a talus. That's metatarsal, 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 cuneiform, navicular bone. That's a navicular bone. So that lady had pain in the navicular bone. And it's here.
This,
Here.
yeah.
That's less painful or more? That's more painful, no? So this is stiffer here. This is but stiffer, it means the navicular bone is different. It pops. The fifth metatarsal, look at the skeleton, has a very thick head. Which is very easy to touch. You see that? A thick head. And these guys break easily. Now, if I'm going, can you go with your finger from the toe all the way to the head? Up, 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 up. Now with the summit, and then I go down. That's the cuboid bone. All right? That's the cuboid bone. Now, just like the navicular bone, the cuboid bone sticking out is the one that should be painful. Where you orient yourself. This is a bit stiffer, and this is kind of bouncy. Here it's more resistant. Okay? So again, navicular bone, with metatarsal, you go up the summit, and then there's the cuboid bone, and then there's the calcaneal. You have to learn how to hold the calcaneus. You don't hold it this way. You have to isolate the calcaneus with your two fingers underneath the malleolus, and that's how you hold the calcaneus. You isolate it. And now you can even mobilize it in a very nice, she feels like a pull here. Sometimes, you feel that? You're releasing the calcaneus. We're still mobilizing here. And then you pull on the calcaneus, and that's why you feel like there's a nice pull. It's silent. But you have to know how to hold the calcaneus and isolate it. So now it's just how to handle the foot. Try to isolate the calcaneus, isolate the ankle joint, which is here, and the calcaneus is down there, right? If you hold the malleoli, the bones, you're not isolating the ankle from the leg. You hold it here, you hold it here. Now there's a nice pull. Okay? Okay. It's
Wanna go?
I want to crack, but I just
You're
want
teasing it.
Yeah. So I want you to have a feel with the feet. Once you feel the foot, there's not much to be done. Everything is quite easy. The hardest part with the foot is it's just a foot, and it's not a functionally. Line is basically a line which is inclined. It's not straight. Where's that thing? Can you? Let me show you. If you look here, it starts here, or that's it here, and it goes diagonally to that big bone down there. So it's this way. It's not straight. So if I'm going to be handling her this frank, I would hold that a bit diagonal here. Okay? And if you gotta do a whip like yesterday, but along that line. Do you want to play with her feet or do you want to start cracking? Do you want to have a feel? Yeah. Orient yourself first. Big toe and the next. You go. That's an navicular bone here. That's an navicular bone. Then go sideways along the small toe. Go up and then you fall down at the cuboid. Appreciate the cuboid. Appreciate the navicular bone. And then isolate the calcaneus alone without holding these guys. Pull and then go down and hold here along with the calcaneus to isolate the foot from the leg, and then check the this frank, which is basically the diagonal line.
If someone had
Let go. Yeah, now you can go deeper. It's the first bone structure you feel. That's a navicular bone. If you go a bit higher, it's a talus. We don't want that.
And it comes across as an angle, does it?
Yeah.
You can nearly see it. If you come this way, look, come this way. You can nearly see it.
Yeah, there's a line.
See?
going to the talus.
Yeah, that's a talus here.
Right.
So if I'm gonna go here, that's
So
where
the first bone.
the first bony or structure you
Yeah.
you know. If you go further, it's a talus. We don't pop this anywhere. That's what we now work on.
Okay.
But patience. Okay. The stretching techniques are done as in you go into distraction, and once you're in that distraction barrier, you don't go back and release anything. You go into distraction barrier. Once you're here, you pop backwards. Most of you will start doing this. You pull, and you go back and you pull back. We don't want that. You pull and you stop where you feel there's a barrier, and from that point on, do a fast pull. There are two ways. Either the easier way is you hold the calcaneus here. All right. My thenar is around the calcaneal bone, and the fingers are here. If I'm gonna be holding it with my hands, I will be covering a lot more area that I don't want. So I isolate the calcaneus, and here I have to go from the tibia down towards the talus, or talus, and I hold that. Okay, now main thing is the malleoli are free. When they're free, you gotta make sure that her leg is kind of released. So I prefer doing it lower and not higher. The higher you go, the more there's gonna be a pull here. Just keep it neutral, and you go back. You pull, and then you just hit it this way. That's like the easiest way. I'll show it again here. You go back, back, back. Make sure she's.
So the foot is kind of neutral, or do you put a little dorsiflexion?
Neutral. Boom.
As they are normally.
No, neutral to do. And that's where you're gonna look at my fingers, because it's gonna be into dorsiflexion mostly. All right, this is gonna be a bit deeper. Here, we're still putting the ankle away from the leg, but we're gonna do it in a different manner. I will go with my thumbs underneath the foot, and I will go and close my fingers in this manner, and I slide them down. While sliding these fingers down, I'm pushing the foot in dorsiflexion, and I lock my fingers technically underneath the talus. So I go, I lock everything here, and I go and I open my fingers, and once I feel the middle finger is on the talus, that's where it's locked. And I go into dorsiflexion. You feel that much more powerful.
Is that hitting the same?
Same thing.
Okay.
But this one does not cause much change. It's just what beginners do. That's the more effective one, and it's like a whip-like movement. This needs a bit of training, but I think it's much more effective. So again, you lock, you go down, and you push up. So what I'm doing is basically getting the foot into this motion. Okay, the first time she pulled, the second time you just pull again. Yeah, and it's much more deeper than the first one. All right, since we're here, next thing I would do is hold the calcaneus and isolate it. And this can be a supporting hand. I can hold it this way. This does nothing anymore. I hold the calcaneus, I distract it, and I just pull like a drawer. I just draw it backwards. Same thing here. I hold that up. I close on the calcaneus. That's it, just the calcaneus. That's a silent one, but she feels like a pull within the calcaneus. Okay? Now, somebody change places.